Hi guys, welcome to Startup Interview. It's Nicolas again, and I'm here with the one and only Elle Quan from Medhyve. Hi Elle, would you like to tell me a bit about yourself, how Medhyve was founded, how you met your partners, and your early investment?
All right, thanks, Nicolo, and I'm happy to be here. So my name is Elle Quan. I am co-founder of Medhyve. We have piloted the project in Philippines, but I'm currently now in Singapore. We have very big visions for Medhyve. We'd like to be a Southeast Asia-wide entity serving the developing markets, particularly the hospitals and clinics in getting their procurement of medical supplies more efficient so they can enjoy lower cost and eventually pass on these savings to the patients. How did Medhyve start? I actually met at a conference on digital healthcare a few years back here in Singapore. I met the then president of the Private Hospitals Association of the Philippines. So this is Dr. Rusty Jimenez. He passed away very recently. I think it was just last month. And I give him credit for this idea because in all the big discussions on digital and technology in healthcare, he actually told me, you know what the Philippines needs? The hospitals in the Philippines need a platform where they can purchase their medical supplies. So I was actually surprised that there isn't any. And after doing my research, I did find out that there is a need for that. What smaller hospitals in Philippines do, and apparently in the other developing markets, they physically canvass their medical supplies. So they send people from the hospitals to travel 3, 4, 5 hours trip and buy their medical supplies to usually it's in a central area, the central business district, or an area where all these supplies are, and they physically bring them to the hospitals. And I thought there is a way to make this more efficient. That's why Medhyve was born. So we are an online platform. We are web-based, and what we have is like a directory of the supplies that hospitals and clinics would need. So these would range from the consumables, the very common nowadays, masks and testing kits and gloves, to items like surgical needs, even big ticket items like machineries and equipment that the hospitals and clinics need to use in providing care to their patients. So that's the story of Medhyve. I have two other co-founders, very young and talented um, individuals. They're also from the Philippines, and I have a CTO. His name is Gab Lopez, and he's in charge of building the infrastructure and making sure everything works on the tech side. And our current CEO, Nigel Lirio, is a family friend. He is in charge of building the business in general, business development, partnerships, strategic alliances. So it's a team made up of family, friends, and like-minded colleagues and peers, I guess.
Just to get a better understanding, could you walk me through what exactly it is that your platform provides that others don't in the market, and what is the hook for a user? Why should they come to Medhyve?
So we have two main profiles that we serve. One are the hospitals, and these are the private hospitals, mainly the smaller family-owned first and second tier hospitals in our market. And on the other side would be the vendors, so the medical supplies vendors. So we're a B2B e-commerce platform, but we're very specialized because we understand our users. So unlike B2C, where you just sell the items, our market is very unique because we have very specific approval certifications. These are medical items, so we need to have medical grade um, supplies that would have to be tested, certified, and approved. So how do we serve our markets? For the hospital side, we provide transparency. So with a platform like Medhyve, there is now lesser chance for kickbacks. And this is very common in developing markets because some procurement people usually tend to favor suppliers because they may be able to get something. So we will do away with that. With digital, it's very, very transparent. We provide search function, we provide canvassing function, and from there, the hospitals can choose which supplier to order from, and then we arrange the delivery and payment. So our hospitals slash buyer side benefit from efficient operations. They also enjoy lower costs because we usually order in bulk, and we're just using technology for good, for their good. So that's for the hospital side. Now for our medical supply vendor side, we are providing AI-led insights into sales, so they would know which products are moving, which geographies are needing more of particular items, so they can stock up on it on certain timings during the year. And we are a new channel. I think, Nick, we've become very relevant lately because of the COVID situation where there are lockdowns. So the industry is used to the medical representative model where people go to hospitals and clinics to sell these medical products, right? Or pharma or device. And because of the lockdowns, that is no longer possible. So these the medical representatives are no longer able to just drive around and go to wherever they want. And that's where we became more relevant, because now big pharma, medical device companies, and actually manufacturers of these consumable items are coming to Medhyve and seeing us as a platform, a channel where how they can get their products in front of the hospitals and clinics.
And as you said, this is a very specific industry that you're in. So how do you work with marketing in order to market Medhyve? So what is your current market strategy for Medhyve?
Yeah, so being a B2B company, it's actually extra challenging because we need to understand definitely how our profiles work and think. So in terms of marketing, we have very targeted outreach. So we have an email a database where we have email marketing campaigns where we regularly update our followers, both on vendor and buyer side, what's new, the products that are upcoming, the new vendors that have signed up. So we build that excitement and that trust as well. We announce to them competitions we won or recognitions we've received. So that's working for now, because principals come to us now because they trust us more. Now, aside from that, we also have very specific outreach to associations. And this is very relevant for the industry because it works on trust. And we are very fortunate that one of our co-founders is really from the hospital operation side. He's a third-generation hospital operator. And our network in the Philippine private hospital community is quite good. So they invite us in their webinars. I've just recently become a panelist in the association event, and I think that's very important, because we need to build trust, and it's not easy to build trust in an industry like healthcare where you talk about lives, you talk about patients, people, families.
What is your current business model? How is Medhyve making money? And also, what are the addressable markets in the future for Medhyve, and what are the current markets for Medhyve?
So I love this question, because now we talk about the vision of Medhyve, and currently we're serving the Philippine market, but we like to serve the rest of the Southeast Asia developing markets. So we're looking at Malaysia, Indonesia, Vietnam, Thailand, Myanmar. These are big markets, and we have similar problems. Eventually, we'd like to go global, but we'd like to strengthen our core presence and service in the Southeast Asia region. In terms of the business model. Right now, we are working on a commission basis. So like an e-commerce platform, we work on a success basis. So all the sales that happens in our platform, we have about 7.5% of commission. So that's from a small item like a mask to big items like medical equipments. As we build our capabilities, aside from the commissions, we are looking to create a software as a service type of product where hospitals can integrate that into their procurement system. So that's probably in the immediate term. And with our AI capabilities, we'd like to be able to sell those insights and information to both the hospital side so that they can save on their inventory, and the vendor side so that they can have insights on what products are moving, where to put their next investment in terms of products, SKUs, geographic locations, where to stock, how much to stock. So I think we're a very, very promising company because we look beyond the present.
I'm sure that our watchers have either future startups or aspiring startups. Can you share any interesting anecdotes or learnings for your fellow entrepreneurs that you picked up over time?
Okay, yes, I so many learnings along the way, so many yeah, blood, sweat, and tears that could be shared. But really, I think I am very fortunate because my co-founders are very young. So uh, Gen Z, are they called? They're Gen Z. I'm not sure if they're Gen Z, but they're lower than the millennials or younger than the millennials. So they have a
Okay, yeah.
very different way of doing things. So I am obviously not a Gen Z. I take pride in years of wisdom and experience. So it's interesting to see how generations work together and their strengths really come up with interesting output. So the strengths of the young people now is really their focus. I think they're focused, so that's very, very interesting. And then I think for older generations like me, we still have that human touch that we put together with the technology. So it's not just a heartless piece of technology or innovation. We still build relationships, we still value networks, and definitely we still want that human touch together with the AI and machine learning and all the digital aspects of the business. So I think that's a good learning that I've picked up in my journey with Medhyve.
Yeah. No, that's really interesting to hear, especially the last part on the mix with Generation Z and other generations and how that benefits your work. That's been Elle Quan with Medhyve. Please don't forget to like, subscribe, and yeah, thank you very much, Elle.